Hi guys, my name is Gregory Mark. Today I want to discuss about BOPT, biologically oriented preparation technique. This is the new strategy. Even it's not a strategy, it's a new strategy, but a new strategy for me, for my practice, and I think it's probably for most of the dentists around the world. Um, the reason, again, we've been using BOPT. We need to clarify for ourselves when is indications in the country indications in this particular cases. So BOPT been introduced by Italian dentist Ignazio in 2013. He was practicing also general dentistry for many years, and then he discovered that something can be done about aesthetics, about preparation technique. What guide him is he sees it's with the shoulder technique or chamfer technique. With time, he will see some recession, and he wants to improve aesthetic techniques and preparation, and that's why he came out with something we call BOPT. Many dentists confuse that it's like a knife edge or vertical preparation that we used to do this all the time. But this is a little bit different. And of course, I won't be able to open the subject completely during my 5 or 10 minutes presentation. We're going to discuss this in our anterior workshop. We're going to go through step by step, and dentists can practice this on mannequins, under microscope, loops, whatever we decide to do. But let's go back again to this BOPT technique. The purpose is to preserve and guide soft tissue healing, prevent gingival recession. That's the most important, preserve and guide tissue healing. Mechanism is specializing bursts causing control intrasulcular wound. It means that you have to create the wound, you have to create the blood clot. So make sure that the blood clot will differentiate itself to thicker biotype tissue. Periodizations guide tissue adaptations. Also, you have to create a different temporary. Make sure you can guide this soft tissue to make it thicker, and you will see in the consecutive slides that's what the shape you're looking for. So the vertical, the step one, it's vertical edgeless intrasulcular preparation. Intrasulcular means many confuse it, so you have to go through the bone prep. This is not. It's a vertical intrasulcular, so you're not violating biological, which is most important. So as I said, it's a gingival curettage and clot formation. That's why they designed the special bores for that. And in step 3, it's reversing temporization to sculpt emergency profile. So we know that we have a marginal line. This is going to be marginal zone. So you also can sculpt, you can move the tissue, I would say call it crown lengthening procedure, soft tissue crown lengthening procedure without doing any procedures, any actually cut soft tissue. You also can increase the soft tissue height without doing any soft tissue grafting. That's most important for that. Systemic review also, what it says. So up to 5 years, the review, it shows only that we have recession 1.7%. So it's great. So it's not much of recession. You can probably see that. That's why making this restorations, making this preparation, it's gonna guide you with less recession or with less cosmetic failure results, put that way. The mid to long-term retrospective outcomes, as you can see here, that's gingival recession is also a very small percentage, which will also be outstanding. Zirconia crowns survival almost 100% within 6 years, also outstanding. So the margin is very thin, it's stable, and the design, the margin is the way you can also see extra cement you can clean easily in this particular cases. And in 10 years respective clinical study, it shows that's a stable gingival margin in pocket depths, high thickness control, and gingival plaque indexes noted. So, saying that we also have favorable gingival health, emergence profile, marginal stability, and bleeding and probing, stressed out for more, of course, long-term studies. So also there is another study in Yemen. They've been checking again recessions, the technique. Again, every study came out almost positive. So the pros and cons on this BOPT. Advantages: so excellent tissue stability and margin adaptation, low recession and high prosthetic survival, an enhanced emergence profile and aesthetics. So limitations, as it says here, steeper learning curve in technique sensitive, yes. So it takes time for you to understand, and slowly when you start implementing into your practice, you will see more positive result, more indications. So when I usually use myself in my practice, I use this preparation when people have periodontal problems, recession. The roots are very thin, so having the chamfer preparations will take you more of the structure. So this is going to be more conservative. As we call it, BOPT, it's a vertical preparation, but actually it's a horizontal preparation. You create the horizontal space between gingival and the root surface, eliminating enamel cement junction. So this create horizontal space for blood clot and creates and transform this biotype, thin biotype, to the thicker biotype. So I also use this when patient has class 5 composite cavities. So you also have to probably you're going to use is a BOPT technique. I use the BOPT technique also on discolored tissue, tooth structure. So having, it's again chamfer preparation, you can see the darkness or grayish color roots through the thinner biotype. But creating this BOPT, creating this horizontal space, increasing thicker tissue, increasing its material thickness also, can mimic or mask this discoloration. Is a very powerful tool, very powerful preparation, very powerful technique. So I think probably this is a lot of indications, and people start using more and more when they start understanding the principal concept of this technique. So conclusion is in the future direction. BOPT consistently shows favorable long-term periodontal and prosthetic outcomes. And of course, the education training program has to be wider and clinical in application. So this board's been developed by David Gerdol. I took permission from him to show his this particular boards. Also, my board's been in development work right now with the Comet company. So soon I'm going to present my design, my way of doing these preparations. And this slide shows how the David is removing cement enamel junction, and you can see flatten the area and creating horizontal spaces you can see between gingiva and the tooth structure. You see also at the end that the tip of the board is smooth, doesn't have a diamond on it, so it will be more gentle to the tissue. I usually prefer not to use this smooth end. I rather probably remove gingival curettage and create a little bit more blood clot. But again, people use different techniques. As I mentioned before, this is super restoration. As you can see over here, you see you have this zone. It's not just a marginal line. A zone is a special emergence profile to support the soft tissue. And you will see within 3 weeks this tissue became very thick, and it's what creates this pleasant appearance of the gingiva. This is where I've been just talked before. That's again, this tip doesn't cover but diamonds. Again, my preferences is to use the diamonds in a particular case. This is a board also with black lines, so you can measure it deep in your sulcus. So the most important again is you have to understand, you have to be with the sulcus depth, not going to the bone. People again making a mistake, but again, you are creating this margin level where you want to put the margin. That's why you're creating this emergence profile, marginal zone. You sculpt the soft tissue if you want, again, making tissue higher or making the tissue a little bit more lower. So again, it's a learning curve. You won't be able probably to get this again, all the information, but implementing this, you will understand more and more. So this slide is to show my case whether I use this BOPT technique. I showed the case in the past, but I want to just go a little bit with details. My thought process. As you can see, original pictures, that's 8 and 9 Nephilim crowns. Of course, patient missing also congenital in number 7. In this particular case, probably with braces, ortho would be great to achieve the cosmetic result, but the patient wants to concentrate only on 8 and 9. As you can see, the gingival level between 8 and 9 are totally different. Okay, the position of 8 and 9 are totally different. Inclination of this teeth are totally different. So, and doing just a regular chamfer in this area with the teeth are very small, okay, will be detrimental for this particular patient. If you look in X-rays, you can see also that the roots are very small. Doing crown lengthening procedure, removing some part of the bone, will also create crown to root ratio, unfavorable crown to root ratio, and develop mobility on this teeth. So you have to be very careful removing these crowns, prepping them, and the crown build up, and then dealing with the final restorations. This is the video you probably been seeing also on my YouTube video. You can see on the full length. Okay, so I'm not gonna go with the detail with every step and showing this 11 minutes of this video, but you will see that I'm trying to remove these crowns. You can see how much inside cement is still on the margin and including this formation. Again, I have to remove the secondary decay. Okay, make this make the build-ups on all adjacent teeth and also on the teeth prep. But as you can see, I'm trying to eliminate all undercuts, so make sure my preparation is very non-aggressive, minimal invasive. I use, again, I didn't have those special boards. I've been using those flame diamond just to remove, just to prep this tooth structure. But when it's done, as you can see, this is the final prep, and you can see how the gingival became more almost even. Just a temporary placing this temporary on this particular patient. The tissue looks much healthy, thicker, as you can see. But also, again, I didn't do any crown lengthening procedure on this particular patient, and the tissue sculpted by itself. Again, it's number 8 moved a little bit more higher. Number 9 is moved a little bit more coronally. As you can see, it's not perfect, but again, I see the great result. This is the final cementation, as you can see here. Again, it's not perfect, but it's much better than the original pictures. Patient's very happy, thrilled. The tissue is much healthier, and as you can see also, that's the tissue responded well, and again, it became much thicker. Of course, this new case. It's almost maybe a year and a half, at least for this particular case. I'm gonna put more pictures for follow-up. But again, it's what I'm trying to say is try to use this technique. You will see more indications in your practice, great results, great the tissue response, and the patient's very happy. And I think that's with the long term of this, we're going to see less and less recession on these particular patients. Hopefully it helps you, and if you have any questions, again, you can send me an email on markgregorydds@yahoo.com. But also you can see our workshop on our website. It's forcehillsdental.com, and click on events. Thank you.